All right, everyone, we're going to be going over contractility factors related to the heart. So the first one is going to be preload, which is just the amount of refill of blood that you're going to have in the heart before the heart contracts and pumps it back out. So one thing that we want to focus on regarding that preload is something called the Frank-Starling principle, which just means that as you increase the filling pressure inside the ventricle, there's going to be increased contraction force that goes along with that. So if we look at this little mock diagram of the heart here, so as blood starts to fill into this left ventricle, and that left ventricle is going to fill up, and get a little bigger. Then with all that filling pressure, then it's going to be able to pump it out harder through that aorta. When it gets filled up more, it'll pump out harder. And then another factor to think about is sympathetic stimulation. The key here is going to be these two things, epinephrine and norepinephrine. So when the sympathetic nervous system is stimulated, these two are going to get released, which is going to cause vasoconstriction of the peripheral blood vessels. What happens when there's vasoconstriction? The blood vessels shrink, get smaller. We know that when volume decreases, given the same amount of material, the pressure inside the blood vessels is therefore going to increase. Therefore, it's going to pump the blood harder and faster. And then finally, with the stimulation of the parasympathetic nervous system, it's gonna stimulate the vagus nerve. Just another thing to keep in mind.
Hi, we're going to continue on with the factors that affect the contractility of the heart. So the myocardium, the muscle of the heart, needs its blood supply and its oxygen supply, and that comes from the coronary arteries. So if something happens to those coronary arteries, such as coronary heart disease, and the coronary arteries are not able to supply the myocardium with the amount of oxygen and blood it needs, then we're going to have some problems. So there is a certain amount of oxygen that it needs to keep getting to work efficiently. We also have something called afterload. This is the force required to open that aortic valve. So coming back over here, the blood coming from that left ventricle, in order to get it to the aorta, the aortic valve needs to open. And once that opens, then the afterload has happened and the blood can flow up through the aorta to the rest of the body. And